The definition of older has really changed, mainly in people's perception of what older is. However, the biological fact is that we do get older and our bodies do change. And so women who are in their late 30s and into their 40s having children are going to be at increased risk of some complications of pregnancy.
In the absence of pre-existing medical problems, there's no reason that a mother can't have a healthy pregnancy, again, regardless of their age. There are potential risks both to the mother and the fetus, but the most important thing is to be healthy before you conceive. So the biggest risk of being an older mother is the fact that as we all get older, we're potentially more likely to have underlying medical problems that are present prior to the pregnancy, such as hypertension or diabetes. But the biggest risks are increased risks of potential complications. They start in the earliest part of pregnancy, and there is a higher risk of miscarriage as we all get older. Once you've made it past the early part of pregnancy, there is a higher potential risk of still carrying a fetus with a chromosomal abnormality, the most well-known of which is Down syndrome. Now there's some non-invasive tests, one of which is just a blood test where we can look at fetal DNA and tell people that there's over a 99.9% chance that they're not carrying a fetus with some of the most common chromosomal abnormalities. And what tests are right for any specific person depends on their history and needs to be discussed with their physician. There's a higher risk of pregnancy-induced hypertension, but that's something that we watch everyone for vigilantly. There's a higher risk of pregnancy-associated diabetes, but everybody has a standard screening test for that. And if these things are detected, then the mother can be cared for so as to avoid any fetal complications.
One of the fallacies, unfortunately, is that we can control when we get pregnant, and it's true to a large extent, but then biology absolutely sets in, and the older we are, the harder it is to get pregnant. And delaying pregnancy until 36 or 37, most of the time you're going to be okay, but 38 or 39 might not be okay. 1 year of delaying it can make a big difference in your odds. The specific odds are going to vary from woman to woman. Obviously, we all know that 25-year-old who cannot conceive despite multiple treatments and all the fertility support that we can now offer. And we all have examples of patients who are 45 and conceive the first time and have healthy babies. My personal record in my practice is we've had a 54-year-old who was spontaneously pregnant with twins and delivered very healthy twin boys at 54. Not on purpose, but it can happen.
Certainly, if you're over the age of 35 and considering pregnancy, it's wise to have a preconception meeting with your obstetrician gynecologist. At that point in time, the first thing that would be discussed would be your menstrual pattern. And as long as you're having regular periods, then likely we would expect that you would be able to conceive. For women over the age of 40, there is a higher chance, potentially, of decreased ovarian reserve. And therefore, after trying for a few months on your own, we have a lower threshold to have an evaluation with a fertility specialist. At the time of the preconception consult, we will review your entire gynecologic history, as well as your medical history and family medical history. And that's a good time to have genetic testing if there's anything that you or your partner may be at potential risk for carrying. And it's a time to discuss how long you would wait before we would be concerned in terms of being able to conceive and deciding whether or not a consultation with a fertility specialist would be necessary.